Summer is the time of year that families are getting outdoors and getting active. We all know that. But did you also know that it's also a time when there's an increase in sports-related injuries? I did not know that. Well, our sponsor, the Detroit Medical Center, wants to share some advice to prevent those exact injuries. Now, joining us now is Dr. John Morasso, a sports medicine physician at the DMC. He's also going to share how you can treat some of those injuries at home. Doctor, good morning. Thank you for being with us.
Thanks for having me.
Of course. So first, let's start simply by talking about what some of these common injuries are that you see this time of year.
Yeah, so anytime there's a change in activity, whether that's starting a new activity, a change in season, or returning to a prior activity after an injury, we're at use for overuse type injuries. These include sprains, tendon issues, strains, and stress fractures.
Okay, so now obviously people want to avoid injuries, all the time, but especially this time of year. So what tips do you have that you want us to follow to prevent these exact injuries?
The most important thing is really trusting your instincts and listening to your body. We don't want to push through pain. Pain is our guide of saying if we keep doing this, we might have a setback. The next thing, and also we really want to ramp things up nice and slowly. So think slow and steady wins the race. The next thing that's really important is proper hydration. So our bodies are comprised of over 60% water, and we really need this water to help lubricate our joints and getting our soft tissues working. So if someone weighed 240 pounds, for example, if you divide that number in half, this is the amount of fluid ounces that you need in one day just for regular hydration.
So we're talking 9 water bottles.
Yes,
That's what you need to hydrate. I like that, and I'm glad that you talked about pain because it used to always be no pain, no gain, but use it as a guide.
Exactly, use that as a guide. The next thing is once you're hydrated and you're acclimated and you've ramped things up, we really want to do dynamic stretching. And that dynamic stretching really gets the elastic properties of our tissues working well so that we're ready for activity.
Okay, all right. Now, well, if there is an injury, how do we know what needs to be addressed as opposed to how do you know that's something that we can treat at home, as opposed to going to the doctor, someone like you?
Yeah, we used to follow RICE, which is rest, ice, compression, and elevation. But the most recent research shows that prolonged rest can actually make things worse. So what we want to do is follow the acronym PEACE. So PEACE, the P stands for protect. We want to let pain be our guide, but we also want to get those tissues moving.
Okay.
E is for elevate, which is just elevating above the level of the heart to help with excessive swelling. A is the biggest shocker for most people, and this is actually avoiding anti-inflammatory type medications.
Really? Okay.
And avoiding ice. So use the ice to keep your beverages cold, but not for the soft tissue injuries, because ice and anti-inflammatory medicines prevent us from feeling that pain, but they also block the first stage of healing, which is inflammation.
Interesting. Okay.
Yeah, and then from there, and then we also have compression. And compression, you can use an elastic bandage and educate the patient on an active approach to their health care.
Okay, so PEACE. There you go. Just remember that. That's great news because this is very different from what we've always been told.
Yes,
yes, this is key information. Now, people assume that sports medicine physicians treat only athletes, but is that the case?
No, we are proud to be the official team docs for the Detroit Red Wings and DCFC, but I treat patients every day in the clinic from all ages, from 2 months old to 102 years old, and we have the unique ability to provide care and address whatever specific goals that patient has, and we have the team approach, and we can give the same competitive edge we give to our professional athletes to everyone.
So us regular people, there's hope. Doctor, thank you so much for being with us today and sharing this cutting edge information for someone like me, I'll tell you. Thank you so much, of course. To learn more about the DMC Sports Medicine Services or to find a doctor, visit dmc.org/sportsmedicine. Again, that's dmc.org/sportsmedicine.